From rising temperatures to decreasing air quality, climate change is a global issue that does and will impact all of us. However, historically underrepresented, low-income, and indigenous communities, in addition to communities of color, are disproportionately exposed to and burdened by its impacts, a phenomenon known as environmental injustice. Hi, my name is Allie Berry, and I'm interested in understanding which environmental and social inequities influence human health and how they might be best represented and addressed through policy and climate action. In 2023, the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Drug Registry published the Environmental Justice Index, or the EJI, an open-source database and mapping tool incorporating census tract data for 36 different variables commonly linked with environmental injustice. While the EJI has been successful in identifying risk factors and areas of concern for policy planning, it lacks some influential variables related to justice and health. This cross-sectional analysis aims to explore the extent to which disproportionate burdens in food access and health outcomes are represented in the EJI. Food access measurements were sourced from the USDA's Food Access Research Atlas, or FARA. They're measured as the share of a census tract's population living beyond a specified radius of a food store, 1 mile for urban, 10 miles for rural. Following in accordance with the percent-ranked structure of the EJI, the FARA values were percent-ranked against each other on a scale from 0 to 1, where 0 equals low injustice and 1 equals high injustice. The resulting values were then coded into R to output a Pearson correlation matrix of food access's relationship with each EJI variable and overall score. A new model of the EJI was then constructed with the addition of food access values, and general common characteristics of the census tracts with the greatest score changes were derived through averages. Upon running Pearson correlations between the EJI and FARA, all correlations were either weak or negligible, including the overall EJI score. In contrast, the correlation between EJI score and poverty values, a factor heavily connected with environmental injustice, yielded a strong positive correlation. This implies that food access as an issue of environmental injustice is not adequately represented in the current Environmental Justice Index. In the upper right hand of the screen is a replication of the current EJI map, followed by the new version. The third map represents change in EJI score, with orange representing increased scores or greater detection of environmental injustice, and blue representing decreased scores, or decreased detection of injustice. Values range from about a 4% decrease to over a 6% increase in score. When broken into rural and urban subsets, 85% of rural tracts with the greatest score increase had high estimated rates of cancer. 55% of those same tracts had high estimated rates of high blood pressure. Thus, the results suggest that cancer and high blood pressure is more prominent in rural census tracts with increased EJI scores. Additional demographic trends suggest that these populations are high in relative proportion of people over the age of 65 and non-incarcerated civilians with a disability. When applied, the addition of food access as a variable to the Environmental Justice Index increased detection of levels of injustice in rural communities with high rates of cancer and high blood pressure. Simultaneously, the lack of access to food is exacerbated by restrictions to mobility that may arise from factors like age and rates of disability, two demographics prominently impacted in our results. State and local leaders are encouraged to use the Environmental Justice Index to better identify and address the specific issues impacting their communities. Lastly, scholars and government officials are encouraged to continually investigate other vulnerabilities of rural communities, including the role of natural disasters and disparities to sexual and gender minorities, access to safe drinking water, proximity to healthcare services, and improved measurements of mental health. I'd like to thank my advisors and the University of Nebraska-Lincoln's Environmental and Sustainability Studies program for their continued support throughout the research process. Thank you!